So it gives me great pleasure to welcome Professor Rajen Naidoo. He is HOD in Occupational and Environmental Health at the University of KZN. Let me just put on my video so you can see me. And he's been in academia really for the last 25 years. His areas of research focus on occupational and environmental respiratory diseases with projects funded by major national and international agencies, including the NRF, NIH, and EU. He has over 95 peer-reviewed publications, and he's on the advisory board of the Internal Archives of Occupational and Environmental Health and the American Journal of Industrial Medicine. He did his postgrad training in occupational medicine at UCT, so he's one of ours, and his doctorate at the University of Michigan. So we're all aware of the huge environmental disaster that happened up in KZN when a chemicals factory went up in flames, and also all the sort of secretiveness around it and the lack of information out in the public sphere about the potential health impacts on surrounding communities. So Rajen is here today to speak to us about the environmental health legal framework, who's protected, and is using the UPL warehouse fire as a case study. Over to you, Rajen.
Thanks, Shaida. So let me just get my screen going. Well, let me first greet you with my video on so everybody can see who I am, because there are some people that may not know me. Okay, hi. So firstly, a very big thank you to colleagues for inviting me to do this presentation, and thanks to all of you for making yourselves available to come and listen. I hope it's going to be a useful interaction. The intention is for there to be much more interaction rather than me talking, and for I intend to raise a few questions which we can then discuss around. So Shada, you can just tell me if my screen is now showing.
Yes, it is.
Right, and it's in the right mode.
I think it's fine. Okay. I think it's fine on my side.
Yes, perfect. Thanks.
Thank you. So basically, the I think Leslie and Shida suggested that maybe I talk about the UPL warehouse fire. And what I thought of doing is, instead of just presenting or describing what happened, was to pick up some of the issues that have emerged that we've seen as a consequence of this fire, particularly in terms of the health of the affected communities, because it's a common theme that's occurred previously in other instances in the South Durban area, and it was really exaggerated now with this UPL warehouse fire. So that's the starting point of the talk. So basically, we know that in South Africa, there has been a string of environmental disasters. It's very poorly documented. For example, I did this Google search, and there was only the single incident that came up in Google on that search was this mine tailings dam from 1994. So clearly, a large number of other incidents occur, but because it is not as catastrophic in that people die, it's not documented. And so ourselves as public health practitioners, government, and others don't really learn from the experiences and don't really understand what are the challenges in each instance. So it's a situation where we go on to recycle all our challenges each time a episode occurs. But one thing we do know is that we have a very good legal framework for environmental health in the country, starting at the very top in our constitution. And I'm sure all of these points that I've highlighted on this slide, people are very familiar with. Our constitution speaks about our right to a safe environment. The Health Act speaks about identifying those that may have caused a problem and instructing those that caused the problem to take appropriate action. At the same time, the National Environmental Management Act does the same thing. It speaks about the people that may be responsible for disasters to immediately assess the problems and find ways to rectify this. And then this cascades down into our municipality health bylaws. So from a health point of view, it seems like legally we're well protected. And even in the times of disaster, we have the concept of the polluter pays. So it's entrenched in our law that the costs of remedying pollution, environmental degradation, and consequent adverse health effects must be borne by the person that or the entity that is responsible for harming the environment. So we've got all of this enshrined in our laws. The question is, does it work? How does it work? And whether we need to pay more attention to how it's implemented. So apart from the polluter pays principle, we also know that, in a number of other settings, the environmental health framework is very strong. So this was the Air Quality Act. And in the Air Quality Act, there was a clear indication that emissions needed to be controlled. So identifying those major polluters in terms of emissions, such as ESCOM, your SASOLs, etc., it was clear that people needed to put into place emissions control. And in 2013, they went one step further. They started to say, well, we're going to make big reductions in the amount of emissions you're allowed to put out. And we're giving you a 5-year lead time in which to address these problems, or it was an 8-year lead time to address these problems. Also, in terms of international standards, although South Africa has been a signatory to the Rotterdam Convention for an extremely long time, we've been very slow in actually putting into place laws and regulations to give some substance to these agreements. But in 2021, the minister implemented one aspect of the Rotterdam Convention, and that was prior informed consent procedure. But what we've seen over the time is that there tends to be backtracking from the regulatory authorities. So, for example, the emission standards that they put into place or proposed way back in 2013, 2015, by 2020, they were saying no. Instead of going for the more stringent emission standards, we're allowing certain people to move towards a different benchmark. What was very interesting was that in 2019, the Department of, well, now they're known as Environment, Forestries, Fisheries, they set up a technical panel to investigate this and to try to establish what would be a reasonable standard for people to back down to. But while this panel was investigating and doing its work, it went ahead anyway and changed the rules for certain of these big emitters. Similarly, although in 2021 they put into place the approach to address the implementation of the Rotterdam Convention, particularly the prior informed consent regulations, by the latter part of last year, they were backtracking on that as well. And the explanation that they gave was that the to allow more time for enterprises and companies to implement these. This is quite an important one with regard to the UPL, and I'll pick that up in a short while. So turning to the UPL warehouse disaster, essentially on the 12th of July last year, this Mumbai-based multinational known as UPL, it was formerly known as the United Phosphorus Limited. It's basically got a very large global footprint. It's one of the top 4 or 5 agrochemical producers in the world, and really a multi-billion-dollar corporation. So for whatever reason, it was targeted during the community protests in July 2021 and was set alight. From what we understand, there were over 700 different chemicals that were stored at this warehouse, including substances that are banned in both the EU in the US. In addition, as I said just now, there are certain substances that appear on the Rotterdam Convention prior informed consent list, which came into law in 2020, in May 2021. So theoretically, ought to have covered the chemicals that were in this factory. But as it was retracted later in the year, we're not quite sure whether the company will be held to that legislation. So within this, as one can expect, within the 700 different chemicals, there were at least over 300 different substances, active ingredients of substances. And these included various organophosphates. Of major concern to us were the arsenates and the manganese-based compounds. So clearly a major problem. But the challenge for us was trying to understand exactly how this exposure would affect human health, because it's not a usual occurrence. Clearly, a large number of these chemicals would have been completely decomposed during the fire and therefore not presenting harm. But at the same time, it's also very likely that large numbers of new chemicals or byproducts emerged as a result of the combustion process. These are just some of the pictures of the extreme heat and fire that emerged from that environment. So for those of you not quite familiar with Durban, I hope you can see my arrow, but this is basically the port of Durban. The factory is located to the north of the port in an area called Konubia, which is pretty close to Umhlanga, and this blow up here shows this much clearer. So those of you reasonably familiar with Durban would know that where my arrow is basically where the Gateway shopping complex is. These Google Earth maps are a little bit outdated, so you can't see the exact location of the factory itself. But around this area here is the Konubia shopping mall. This open space here is where the current macro is located, and the UPL factory was located in this area. Just outside this map here is where you have the location of the informal community of Blackburn, but all of these here are the sort of middle and upper middle class gated communities of Umhlanga and Umhlanga North. So all of these communities were affected. So this once again shows you basically the factory and the different likely areas of exposure. The red arrow represents the sort of wind direction that was experienced at that point in time. The Blackburn Informal Village is located there. So the modeling that had been done by the consultants that were appointed by the company produced these sorts of reports that are now in the public domain. These reports just emerged in the public domain in the last week. So this shows you here the fallout. These red dots are basically community complaints or complaints that they recorded from members of the community. And as you can see, quite densely around the key point, but there's also some that have been recorded outside the main zones. So what we see here is the point at which the factory is located, and then just slightly northeast of that is the Blackburn village, which is probably the most affected community in this entire sort of exposure. And one of the biggest problems that occurred there, as shown in this figure, is that because of the poorly controlled firefighting techniques, a large amount of the water that came through in the firefighting process basically entered into the water sources in the area. So this slide here shows you where the factory is, and these are little rivers that run through here all the way down into the Umhlangani estuary. This is this big blue spot here, and here you can see the Blackburn village. So the river, basically runs right through the village, and it forms a source of well, it's a source of water supply for the community, as I'll speak about just now. So clearly, there was extensive contamination of most media, that's including air, soil, and water. The concerns around the soil and water contamination is the fact that people do subsistence fishing in the area, also use these sources for both recreation and cleaning. To the best of our understanding, people do not use these sources for drinking as they have piped water, but it's possible that there may be some boreholes in the community. Similarly, this area is located in the agricultural sugarcane heartland of North Durban, and so certainly the sugarcane plantations may have been were affected to some extent. The company, under direction from the UPL, from the government, implemented some immediate sort of environmental control mechanisms, which we'll speak about just now. But these pictures are just showing you that in addition to the contamination of the soil and the water, we had, this was basically the color of the water that was running through these communities immediately after the fire. So clearly highly contaminated and seeping both into the water as well as into the soil in the area. And this is the dead fish that was seen, and there were tons of dead fish that were picked out of the river. Cleaning up of the beaches, because from the Mhlanga estuary, it fed directly into the beaches. Beaches had to be closed for an extended period of time. And these were just some of the results. I hope you can see the slide clearly, but just from looking at the water and soil samples, now these are from the consultants that were employed by the company, and you can see that for certain of these substances, extremely high levels were found in the water and soil samples. And these are basically, the different columns are indicating the different sites at which these samples were collected, and clearly closer to the factory itself, extremely high, and as you move down the river and into the estuary, this tended to decline. But bear in mind, these are results that came in probably within a week to 10 days after the fire. So it may be that as things went on at a later stage, the levels lower down the water system may have become higher. And as of October last year, this was the amount of waste that was collected and dispatched by the waste companies. So about 18 million kilograms of solid waste, 58 million liters of liquid, and almost 4,000 kilograms of dead fish. These were sent to two hazardous sites in Kwadukuza in KZN, as well as to sites in Gauteng. So the question is, how are these sites being managed, and to what extent this is now posing a risk to other communities in other parts of the country? So the question is, what went wrong? So we need to start from before the fire itself. Firstly, the business that was the warehouse ought to have been listed, constituted as a listed activity in terms of NEMA. The company contests this and argues that the chemicals that it had was not in the list of chemicals recorded in NEMA, and therefore it didn't have to be constituted as a listed activity. But it would have required an environmental authorization, which the company did not have. The company argued that it was not a major hazardous installation, and therefore it did not need to meet the MHI regulations. and it did not obtain any scheduled activities permit from the municipality. So the company was operating for 3 to 4 months before it went up in smoke. The question is, how was this not small operation able to conduct its business right in the heart of Durban in complete breach of all of these laws without any attention by any regulatory agency? I mean, if you think of it, I mean, the chemicals had to be imported into the country. It had to have come through our ports. How is that managed at the port level? Who asks the questions? Where is this going to? What is this for? And then follow that up to find out exactly where it's being dispatched, where it's being stored. But none of these things were done. So clearly, when you look, although we have a very good sort of framework around environmental health, because the legislative framework is so fragmented, things tend to fall through the cracks. So you've got the Occupational Health and Safety Act, you've got the NEMA, which is meant to be managed by the Department of what we call it Economic Development, Tourism and Environmental Affairs. We've got environmental health, which is a municipality responsibility as per our National Health Act. And then there's also the business activities schedules that require municipality approval. So all of these things are taking place by different agencies who don't speak to each other and therefore are not able to ensure that companies are meeting the requirements that they need to. So what happened afterwards? After the fire, basically under the direction of what we call EDTI, the Economic Development, Tourism and Environmental Affairs Department, they pulled together the teams and they then set up a directive, and UPL then was instructed to appoint a range of technical experts to assess the extent of the problem and then to implement some form of decontamination. UPL immediately assembled these large teams of experts, and they generally focused on the environment. To a large extent, it was almost exclusively environment. They did appoint occupational hygienists to conduct a health risk assessment, but there was absolutely no interest on assessing the health of affected communities. Neither local government nor UPL, local government is responsible for providing health for the communities, really got their act together to coordinate a response. And to a large extent, this was because of UPL's original position. They basically, in the about 24 to 48 hours after the fire, they instructed people to remain indoors and wear masks and glasses to cover their eyes. And basically in press statements, they indicated that as far as they're concerned, as far as based on advice from their own toxicologist, there's a minimal risk of long-term effects to the health of people exposed to the smoke from the warehouse. So clearly based on these, they did not prioritize the health of the communities. Shortly afterwards, there was a health risk assessment that was commenced, but this also failed to be systematic in assessing what was going on in terms of the health of the affected people. What had happened afterwards, and this was now probably around about November, December, after we had started putting pressure on them through community groups and ourselves from the department here, they started jointly with the municipality health services. They established a clinic where people were entitled to go to if they believed that they were having problems as a result of the exposure. To the best of our understanding, the service is not being taken up in high numbers by the affected communities, and it's not clear what the reason for this is. It's also not clear what problems are being identified in these clinics and how these problems are being identified, or how these problems are being managed. We do know that the people that have been appointed to run the service are employed totally by UPL, and they're bound by a whole range of non-disclosure agreements. So the information coming from the clinic is very poor. So the question that I have is, why is this seemingly poor attention paid to the health effects amongst the exposed communities? I went to a couple of the presentations by these technical experts, and clearly the company basically operated on a blank checkbook approach in terms of addressing what was going on with the environment. So they were prepared to invest large amounts of money to address and contain the environmental issues, but almost nothing was done for assessing the health of the communities themselves. And the question is why? I'd like to pick up this when we start our discussion rather than trying to answer the questions now. Then we come to the question is, whose responsibility is it for health assessments? And the community was obviously extremely aggrieved, both at the polluter, but they were also very angry with local government. They felt local government ought to have been doing more to provide them with services to assess what was going on. And here, when I speak about the community, I'm speaking about the informal community. Those in the formal communities living in the sort of middle class communities around the warehouse were able to access private healthcare. We don't know the extent to which people did this and how many people did it and for what problems, but that's our understanding. So as far as the informal community goes, whose responsibility was it? Now, bear in mind that this was taking place right in the midst of the pandemic. Local government was already stretched with provision of clinical services to these communities, focusing on the COVID-19 issues, and for them to have taken the extra step to address issues related to this disaster was quite a stretch already. So the first question is, who should be responsible? The third option is, should it be local government paid for by the polluter? And obviously, most of us think, yes, in terms of the polluter pays principle, this is what's going to happen. Local government does not have the resources and the services to implement, to address the health of these communities. It therefore must be paid for the polluter. And the question then becomes, what is the mechanism for the polluter to pay for this? So while we have in our law, in our constitution, the polluter pays, there is no financial mechanism that is stipulated in the legislation. There have been, in the recent years, financial mechanisms proposed as amendments to NEMA for addressing problems associated with mining disasters, or, for example, with the mine acid drainage problems that was experienced in the Gauteng area. And the question was, how do we make sure that the mining companies pay for the cleaning up of the water supply, and going on beyond just cleaning up, and also addressing issues of future contamination by the mining services. So that is specific for the environment, and it's specific for the mining industry. There's no other provision made for financial mechanisms for disasters such as these. And because of the absence of these financial mechanisms, and because there is no way that the polluter can hand over funding to either any one of the regulatory agencies, including local government. Basically, local government or government in its entirety hands over the service provision responsibility to the polluter. So the polluter is expected to pay for for clinical services, is expected to employ people that will staff these services, and to a large extent, because of the scale of the disaster, the polluter is happy to do these things because it becomes a show of social responsibility. So, you know, it's a means of trying to improve the image, improve the brand image by providing these sorts of services. But the polluter then takes control of this very important service. People are employed to manage these services under non-disclosure agreements. So suddenly, the affected communities as a whole have no information about what problems are being identified through these processes. Okay, there's absolutely certainly with the UPL approach, no oversight over how these assessments have been taking place, what sort of services have been provided, how are the rights of the people protected in terms of confidentiality, in terms of ethics, if the information is not being shared with third parties that are supportive of the communities, is it being shared with the employer, which in this instance is UPL. At the same time, we've not seen any commitment from the company, we've not seen any commitment from local government to put pressure on the polluter to address issues related to chronic health outcomes as well as delayed health outcomes. And also, although we don't know that we're going to see this in this setting, but also transgenerational. So I'm talking more generally now in other forms of disasters that may occur. You know, we know things like Minamata, etc., where things cross over generations. Who takes care of communities in those sorts of instances? And this then also speaks to issues about, do we do it for the lifespan of this individual polluter? Do we do it for a long term? And then how does this get managed? And for this, we need to start thinking about new mechanisms around how these issues get managed in protecting the health of communities. Do we need to start thinking about an independent environmental authority? I know many of us start to get concerned when we start talking about independent state agencies, you know, because of the issues around corruption, management, and corporate responsibility. But do we need something like this, which is able to respond immediately and urgently to a disaster, and then takes control of how that is managed, both from a point of view of environmental management as well as healthcare provision? We need to start thinking about new financial mechanisms in terms of the regulations that were proposed for the mining environmental contamination that I just spoke about. There were options such as the establishment of independent trusts, and we have that in the occupational setting, where we have a variety of trusts that have been set up to address the health outcomes of ex-miners. There's also financial vehicles that can be set up through the trust funds that could be set up within the government departments to focus on these sorts of issues. And then, of course, there's the compensation fund model that we see in occupational health. Should we be thinking about these models for protecting the health of communities post a disaster? So just some concluding concerns and comments. As I said, I think there's a healthy legislative framework that exists, but this framework is continuously undermined by government and the regulatory agencies within government, and it clearly becomes a political playing field as to why there's backtracking on these things. It's not always based on health considerations. Then we have a pervasive, unscrupulous business practice. We know that it's not as if companies are doing business openly, transparently, focusing on protecting the health of communities. In the last 4 to 5 years, we've had major incidences in South Durban alone, and in each one of these instances, the company basically washes its hands of protecting the health of the communities. If people experience health outcomes, then it becomes a responsibility of the individual to prove that this was related to the exposure. And we know that that becomes a major challenge for the individual. Companies have large resources at their disposal, employing technical experts who are able to defend the position of companies. And unfortunately, sometimes these are from the scientific community as well. What becomes a concern is that there's almost no regard for what I refer to as the silent health consequences, that poor birth outcomes that people may experience months to years after exposure, the child with learning difficulties, the adult who develops some sort of chronic respiratory problem years post-exposure becomes uncompensated. And then the mechanisms for implementing the polluter pays principles must be established. We just don't have anything at the moment, and we've got to figure out exactly how this now starts to get implemented. And as I said before, the unfunded liabilities for health, we need to consider long-term and delayed outcomes, including transgenerational outcomes. And these have to consider the fact that one, companies may not have a long lifespan, so it cannot be only on the basis that while the company is in existence. There is also concerns, given that we're working with multinationals, there was nothing stopping UPL from closing shop and moving out of South Africa, and washing its hands of any responsibilities here. And that danger still exists. It's not a question, there's no mechanisms to tie them down to staying in South Africa. So all of these things become quite critical issues for us to think about. So thank you for your time. Thank you for listening. And I'm looking forward to some of the discussions and debates that we could have now. Thanks, Shahida.
Thank you, Rajan. Thanks so much for a very insightful and critical presentation. So I'm going to kick off with a comment. I and some other people have been involved with the Macassar disaster, and that's been exactly our experience. Very little focus on the health impacts as it affects people. I think the farmers were paid out almost immediately because of the damage that the sulfur or dioxide did to the crops, the surrounding farmers. After a few years and much work by the sort of medical panel and the Legal Aid Board clinic, a couple of thousand people got paid out for acute inconvenience claims. And then we had a handful, maybe 100 or so people who had persistent and long-term chronic health impacts, and we worked them up quite vigorously, got them to specialists to confirm, and those people were never compensated. And, that was way back in 1995. So it's sort of quite instructive that so many years later we're sitting with the same problem, but with a disaster that's maybe on a much bigger scale. So I just wanted to ask, with respect to NEMA, you mentioned that it's the responsibility to immediately assess the impact and obviously try and mitigate and manage the impact. Is there a time limit to it? Because it strikes me with UPL, I mean, there was an immediate impact in terms of water quality, air quality, and obviously people's health, because people were told to protect themselves and cover up and wear, masks and that sort of thing. But is there a time limit under NEMA? Because this thing happened in July and we are now about 7 months later. And we've only, the report has just come out now identifying what was, what those pollutants were.
So there is a time limit, a specification in NEMA about how soon the polluter needs to provide the information and the reports. But what was clear was that because of the scale of the problem, those short time frames, I think it's within 2 weeks. In some instances, they need to provide the information, and that was certainly not doable, in terms of all the work that needed to be done here and assessing the extent. But I think the 6-month period was definitely extremely protracted. And the problem was here is you needed to know exactly what the chemicals were that were affecting these the air, soil, water, etc. But at the same time, you didn't need to wait, and this is what I was objecting to. You didn't need to wait till a full health risk assessment was done before you decided that right now let's go and assess the health of the people. And
Thanks.
And that's the issue. Yeah.
Thanks, Mohammed. I see you've got your hand up.
Thank you, Shahida. Thank you, Rajan, for the very interesting presentation. I have two comments. Firstly, the question. Do you think there is any case for a class action suit similar to what was taken up with the Makassar disaster? Is there enough evidence for that? I take your point with regard to the adverse health outcomes. We are in the dark with regard to that, but based on the environmental exposure measurements, is there a case for that, and is something being contemplated with the community with regard to that? And then my second question relates to the chemicals that were alluded to. I saw a report from these professionals, and they indicate that the chemicals most likely to be present in the smoke included hydrogen cyanide, hydrochloric acid, and bromine, as well as SO2, NO2, and PM. Do you want to comment on any of the kind of complaints that are coming from the community in relation to these particular chemicals? Are there any kind of associations that we can draw from that? Thanks.
Thanks, Mohammed. So the first question about class action suit. So at this point in time, we don't have sufficient documentation of health effects. There was, so you basically, we would have expected to see some acute outcomes, things like your acute respiratory effects, your acute cardiac effects, skin problems, etc., upper respiratory tract infection, upper respiratory tract inflammation, etc. And that was missed because nobody was documenting it at that point in time. It is likely that those people in the formal communities were going to the private health providers, and they were getting managed there, but we didn't. Then there was a question of the subacute and chronic outcomes. So in other words, things that would have been persisting, such as, and here again, we don't have that information. And the so because we don't have, sufficient evidence of health outcomes, I think it's going to be a bit of a challenge to implement a class action suit at this point in time. We really need to now start documenting the health effects that are persisting in the community. Fortunately, some of the activist groups working here have a large number of activist environmental lawyers, and they have a good understanding of class action suits and things like that. So it's certainly on the cards, but it's a question of getting the evidence to take these challenges up. But as we said, we're working with a extremely large multinational corporation, well-resourced, so it is going to be a challenge. By the way, I was appointed onto the what was called a joint operations committee, which consists of all the government departments making inputs into the reports. And at best I could assume it was the company putting pressure on the environmental affairs department here, and they were not happy with my involvement in that grouping, the JOC, and I was subsequently asked to remove myself from that, and they wrote to the university asking for the university to remove me from that structure. So they have means and control at all levels within this. They're currently objecting to the participation of community groupings and the multi-stakeholder forums on the sort of joint governmental structures. So there's always this pushback in trying to get information. Just quickly remind me, what was your second question, Mohammed?
It was getting more specific around the chemicals that actually were implicated based on the report that was published, and whether our community is complaining of those specific symptoms that are related to those chemicals. Thanks.
So the reports that we got was that most of the people were complaining of symptoms associated with irritant exposure. So your upper respiratory tract, your lower respiratory tract complaints were commonly heard about. And once again, there was no mechanism by which to collect this information. So there were some groups that was collecting information, and largely this was what was being reported. And that's what we'd expect from these agents that the that air quality report presented with, right? So they were largely the your irritants, your chlorines, your bromine gases, and things like that. The bigger concern for us going forward is much of these pesticides are now in the soil and in the water around these communities, and there could be slow release, and people would be exposed to these chemicals, these pollutants, at low doses, for a long period of time, and the outcomes there would be completely different. So at the moment, we've put in a grant application to NIH to look at biomarkers for cancer outcomes and other epigenetic effects that one would expect to see from low dose exposures, particularly among children.
Thanks, Rajen. I'm going to move to the chat. There's a question from Leslie. Do you think that the National Institute of Environmental Health, to be established under NAPISA, would be the appropriate structure to which polluter penalty should be paid in order to carry out effective assessment and surveillance, to avoid the conflict of interest where the polluter fulfills their financial obligation without deciding on how the remedial steps are taken?
So for me, thanks for that question, Leslie. So for me, the any mechanism that is likely to work, that is independent of the polluter and to some extent independent of government, will be the way to go. The question is, how do you get the polluter who's not yet been charged, who's not yet been found guilty, to put money into a fund? Now, with the models that we have in the occupational diseases settings, these have come after the fact, and it's gone through protracted court cases and things like that before. Now, I mean, for these sorts of health outcomes, one can't wait for that long period of time. So is there something to be in the regulations that says, well, if there's assumed contamination by a polluter, then they're expected to pay this money into a trust fund? So I think the debate has to be started about how these funds will be obtained and accumulated and then dispersed in different sort of settings. And I think that debate has to start soon, but I don't have the answers for it.
Leslie,
I mean, the compensation fund is one, sort of insurance policy where people contribute to the fund independently of having caused an injury or disease. And maybe that's one approach.
Leslie, you've got your hand up. Do you want to comment or ask another question?
No, I think that's the trick. I think, you know, the state has got a big revenue base. I mean, it misuses its revenue base, but there's nothing to stop the state from actually implementing the surveillance in a proper way and then levying a penalty. And the penalty can be raised afterwards, and maybe the amount of money that comes in is not what the amount of money that's spent, but it's not a commercial enterprise that can only do surveillance if it gets the money up front. And the question is really whether it'll do a good job and whether it's independent. And as you say, you know, state agencies are not necessarily very independent, but I think for practical purposes, it's a structure that is going to be there. We will not have an EPA, you know, for another 2 decades or however long it takes to negotiate something like that. And it's relatively arm's length from kind of who makes decisions. So we hope that a National Environmental Institute will be sort of staffed by professional people who have good lobbying for them upfront.
Thanks, Leslie. There's a question from Itumaleng that I'm just going to read out. Rajen, what methods were used to capture or survey community complaints? Seems very few from the informal settlement compared to middle-class gated communities. And then there was another one. He asked whether there were any reports from the local public health services regarding increased health complaints from the communities. Rajan?
Can you hear me?
Yeah, we can hear you now.
So basically there was the approach taken by local government was having their usual mobile clinic services and asking people to report to this mobile service if they had any problems. And from what they reported, there were very few people that came forward and said they had associated problems. What the company did was set up a online complaints system. So you could go complaints, health problems that you may have had using their one-page questionnaire, and the people that were responsible for the health risk assessments also went in and did a very quick survey, and most of the symptoms that they presented was just the acute sort of upper respiratory tract things like cough and nasal irritations and skin problems. So nothing else beyond that.
Thanks. Akhil, you've got a question? Go ahead.
Thank you very much, Rajan. Very interesting and very nice presentation, which I enjoyed. Just got a small, you mentioned quite a lot of possible contamination or presence of the chemicals in the environmental media, including the water, and you showed us the river. You did indicate that not a lot is used for drinking, but maybe if you could just maybe expand on that. Do the people not use water for any purposes, for potable, or sometimes it's not a normal, but they might still be used, and any other possible exposures that the community around there might be exposed to the environment, maybe in a work setting or so.
So basically, we know that there's some members in that informal community that do have subsistence farms. So they do plant things in their homes and grow things, and that may have been contaminated. There are people, fisher folk that do subsistence fishing in the area, and so they're likely to be at risk. But from the best of our understanding, the river and the water sources around the community is largely used for cleaning purposes and for maybe with the kids using it for recreational purposes. The community receives piped water from the municipality, so they shouldn't be using this water for using the contaminated water for drinking.
Thanks.
Any other questions? Anybody else? I see Mohammed has posted some resources, one on the disaster itself and one on the Macassar paper that was published looking at factors associated with persistent lower respiratory symptoms or asthma amongst people exposed. Thanks, Mohammed. And I see Leslie's provided a bit of an expose on, I think that is the company hygienist, or Gerard Verdoen, the person who worked for UPL, as being very much an industry spokesperson. No other questions? Mohammed, I see you've got your hand up.
You may have covered this, but did you say anything about the workers at this warehouse? Were they, I suspect, I don't know, they probably weren't around then when the fire happened. Or do you know anything more about the workers there? Thanks.
Yeah, I mean, we don't know much information about the workers prior to the incident. One would assume that post the incident, they were not affected unless they lived in the community. And there were not, from what I gather, not too many people living in that informal community working there. But certainly from an occupational health point of view, from the anecdotal reports that we had, the cleanup crews were definitely affected. So a lot of people were presenting largely with dermatological issues and maybe others, but we were not privy to this. But certainly anecdotally, the large numbers of workers doing the cleaning up were, some of them were affected.
Thanks. There's two comments regarding this issue of online complaints, the company having sort of opened up an online site for people to track their complaints. I think Leslie making the point that it favors higher socioeconomic communities because they're more likely to have internet access, and Siki is saying that online tools as measures to track potential harms will be ineffective if they are not implemented at community level on a long-term basis and will exempt company from assuming due responsibility. Do you want to comment on that? I mean, was that taken up in a big way, the whole online complaint process?
So, I mean, there's lots of problems with the online process. You're right. Most importantly, it was access, and there was no indication of who was reporting, what was being reported, what were the complaints, except for the company telling us, there were not many complaints. And then in terms of this being used as an ongoing surveillance tool, you're right, it's next to useless because it was not standardized. There was no means to assess who was reporting, how the reporting was being done. And also bear in mind that these communities are going to only report. I mean, the basis of them reporting is, do you believe that your problem was as a result of the exposure? Now, most people are going to only associate the acute effects that they experience. So it's the upper respiratory tract, it's your other chest problems and your dermatological issues as associated with exposure. If you have a adverse birth outcome down the line a few months later, if you have any other neurological problems down the line, nobody makes that link. I mean, most of us wouldn't. And these are communities that are not so clued up about environmental contamination and health outcome. They're not going to make the link, so they're not going to report it.
Thanks. So it seems like long-term one would be worrying about neurological and endocrine disruptive effects, which is quite hard to monitor and look out for if systems are not in place.
Absolutely, yeah. Well, we hope that we do get some funding for this and that we can implement some sort of program around those sorts of issues going into the future. But without that level of funding, unless we can put pressure on the state, well, not pressure on the state, pressure through the state on the company to provide these resources, it's going to be a non-starter.
So Nitsiki is saying this would be a nice project for students to track self-reported harms. So that you might have a collaboration from our side if interested. And Leslie's mentioned the long-term impact of carcinogens as well. So I'm sure a lot of these pollutants are also carcinogens. Rajen, from our side, I want to thank you for presenting on behalf of the center. Obviously, from the discussion, it's a very topical thing, and I think it's something it's something that's going to be with us for a long time. And we wish you well in your research endeavors to encounter, to unveil some of the effects. I think that's been so hidden and secretive up until now. Thank you.
Thank you very much, and thanks for everybody for coming in and listening.
Thank you. Bye.
Thank
Bye,
you.
everybody.
Great presentation. Thanks.